Not the time to start saying, oh, you're having mood swings or hormonal change. Yes, we know it's hormonal change, but guess what? They didn't create themselves. We didn't create ourselves. Hello, my Red Tribe, and welcome to another episode of Dr. Red Diaries. We're still in the month of March. It is still Women's Health Month. And today's topic, we're talking about menstrual pain. This topic now is for both men and for women. The reason I included men first is because you guys need to come to the front seat, sit down and listen. Let's talk about menstrual health or menstrual pain. Let's even start from before the period starts. You understand? The things that go on in the woman's body, we call it PMS. Women have several symptoms. Some of them are irritable. What I mean irritable, like angry, hungry, tired, stressed. Women have been able to figure out a way to manage the emotion. The symptom might not be as severe, yes, for some women as for the others. It depends on the woman. If you are with someone, you need to learn this, because most of the time when that is happening, it's not about whether it's not the time to start saying, oh, you're having mood swings or hormonal change. Yes, we know it's hormonal change, but guess what? They didn't create themselves. We didn't create ourselves. You can't now use that as a reason to make the woman feel, because trust me, she's going through a lot. And sometimes some women even have premenstrual pains, cramps. Yes, they have cramps before the cramp. So they already started feeling the pain. There's breast tenderness, weight gain, even stooling and vomiting. But today I'm really going to talk about some medical conditions that some women might have that they may not be aware that would be aggravating their menstrual pain symptoms or their menstrual cycle symptoms or their period symptoms. I'm going to speak from a personal experience. Why? Because I want to share an information. When I started seeing my period when I was in my secondary school, for example, my period started as irregular, painful, so painful that sometimes I will miss school, I'll miss like classes, I'll be rolling on the floor, I'll be saying, God have mercy. Stooling and vomiting used to come with it. You understand? But as I grew older, the symptoms actually reduced. Why? Because one thing I did different, I understood my body. Yes, I'm a doctor. That played a huge role, but I started learning about my body. I started learning about the things I should do, I should not do before, during, and after my period. As I started growing, of course, hormonal changes and all, but I started trying to figure out things I can do better to help reduce the pain, or even not even have any pain at all. I shared that story to say this. How menstrual pain can be common. I don't want to say it's normal, but yes, can be normal because it is cramp. You get the uterus is going through a process. You get, and there are mouth contractions. These are normal human or body changes that is happening. Mild cramp or mild pain can be normal, but pain again that will make you miss school. That's why I shared the story. That will make you miss work, cause excessive vomiting, fainting, requires injections every month, pain that gets worse over time. There's some people that are on their period, let's say for 5 days duration, and 3 days, 4 days, pains that would cause painful intercourse or associated with infertility. Those are not normal. And I'm going to talk about some medical conditions that may aggravate or really cause or make those symptoms worse or come about those symptoms. Those things are not normal. Those symptoms are not necessarily normal. They may require further investigation. So let's talk about some conditions that are often missed in Nigerian women. General overview, missed Nigerian women that can really aggravate menstrual pain. Number one on the list, endometriosis. So the reason I'm talking about endometriosis as number one, I said number one is because it is often missed. We get to say, I've seen very few endometriosis type. And I'm not saying there should be a lot, but I'm saying most times they don't diagnose it. It's what the woman might be dealing with, but it's always misdiagnosed or wrongfully diagnosed as something else. I might call it maybe dysmenorrhea or something else that's painful menstruation. They often misdiagnose it. But endometriosis is one of the most common reasons for some of the symptoms I mentioned earlier. What are some of the things? Let me just give a brief explanation of what endometriosis is. It's a condition where tissue similar to the lining of the womb grows outside of it. You understand? Tissue is supposed to be growing inside the uterus, start growing outside. That's lining of the uterus, start growing outside of it. What are some of the symptoms? Severe pelvic pain, pain during sex, heavy period, infertility. I had a patient some years back that when she came to me, when I was working in the health center, I saw a lot of cases. She came to me and then her period just started. She was in serious pain. Then she started explaining that that's how she's always in pain. That every month for like 5 days, it's as if she's fighting a battle. She's always in pain. She was rolling. I had to give her hyoscine, give her some injections to calm her down. Then I sent her for scan because she said she had done tests. I asked her, she don't scan. I think she said she didn't really do scan. I can't really remember the conversation we had for me to insist that she does another scan. And I referred her somewhere else to do a particular place to do the scan. Again, just because I know those people will do the scan well and better. She went for the scan, came back. Guess what? She had endometriosis because all the stuff she was describing was tilting towards endometriosis, but she has never been diagnosed. But she says she has been to the hospital, they've prescribed several medications, given her several pain medications, injections, and so on and so forth. But no, she's not getting better. When she did the scan suggested endometriosis. And I explained it to her. And I also told her that I referred her to see a gynecologist. Endometriosis globally affects 1 in 10 women of reproductive age. That's why I said it's common. 1 in 10, that's a lot. Not 1 in 1 or 1 in 1,000, 1 in 10. But in this our country, Nigeria, it is often undiagnosed. Pain. We've tagged it as dysmenorrhea. Pain is painful menstruation now. It may not necessarily be. So if you have the symptom that I mentioned earlier, and you've been having it for quite a long time, please maybe you need to go for an invasive scan. You can do a transvaginal scan or go to somewhere the sonographer is good and will do a proper scan for you, an abdominopelvic scan. So to see if it's truly endometriosis that you are dealing with, so you can be able to find treatment and solution towards it. Another next common medical condition that will cause painful menstruation, heavy bleeding is, the most common one, fibroid. It's extremely common amongst Nigerian women. And studies have shown that Black women are more likely to develop fibroid at any given age and mostly at younger ages. Those are the symptoms: heavy bleeding, painful cramps or severe cramps, intermittent bleedings, sometimes where you bleed twice a day. Not twice a day, sorry, twice in a month sometimes. Pelvic pressure, there's this heaviness most times on the pelvic bone. Frequent urination, anemia. But again, many women are told to manage it. Let's move to the next symptom. Next medical condition, adenomyosis. Often we mistake adenomyosis for normal menstrual pain. Some of the causes, I mentioned the causes earlier, and very heavy periods, severe cramps, enlarged uterus. This one is not fibroid, the uterus is enlarged. Most times it might look like the person is bloating. Another common symptom medical condition is PID. That's pelvic inflammatory disease. It's mostly an untreated infection that can lead to chronic pelvic pain, infertility, and a very common ectopic pregnancy. Women that have ectopic pregnancy most times is due to PID. This is commonly treated, but most times not properly treated. Experiencing any of these symptoms, it is better to go and have several tests done. What are the tests that you can do? I mentioned transvaginal scan. I mentioned the abdominal pelvic scan, not just a pelvic scan, but do an abdominal pelvic scan so we won't see what's going on in the whole digestive tract and the reproductive tract. Do the pelvic scan, do some full blood count and some blood tests to know exactly. Do endocervical swab, high vaginal swab, urinalysis, urine MCS. The reason you're doing all these tests and also the urine test is so that you can be sure to know exactly what's going on. Then full blood count, then with PCV, and then ESR to rule out any form of inflammation, maybe low blood level, infection, and so on and so forth. Those are a list of tests that you can actually get carried out and do them early and on time. So if you are currently having to deal with these symptoms, please try as much as possible to go to a diagnostic center, do this test, and see a gynecologist. One of the things that I've noticed about most women in Nigeria is that we don't see gynecologists. Let me explain what I mean. Standardly, the way some of us, we see opticians, we see dentists twice a year. Even more. We go to the optical center sometimes twice a year. We treat malaria. We see the doctor. We need to take our reproductive health more seriously. This is for the women. You need to see the gynecologist at least once a year. At least once a year. You're not looking for anything, but again, so that you can be able to be updated with yourself, with your reproductive organs, with your body. Especially ladies, especially girls or young women that are at reproductive age. Once you started seeing your period, you need to start scheduling it. Mothers, for your young daughters, again, not the ones, I don't want to go into all that, but schedule for them to see gynecologists at least once a year. Young adults, you're planning to get married or you're married, schedule to see a gynecologist at least once in a year. It will save you a whole lot of stress. It will make you more aware of your body and what's going on in and with your body. To my fellow doctors that often tends to misdiagnose these particular symptoms, please, let's try as much as possible to listen without interrupting. Be patient. I know we're dealing with a lot right now in Nigeria, but we have to be patient with these women when they come with this such complaints and get them to do some tests. Do some of these tests which I mentioned and the tests that they are supposed to carry out. They are aware and they can start treatment early and on time. Thank you so much for watching today's episode. I will see you in my next episode.